Dear colleagues, I am thrilled to introduce a remarkable advancement in systemic lupus erythematosus management, how to predict and measure flares in daily clinical practice. While remission is the goal for management of lupus, the reality is that flares persist, disrupting progress and leading to increased damage in patients. Yet, identifying these flares reliably in clinical practice has been a significant challenge, often shrouded in uncertainty and guesswork. Until recently, the lack of a validated instrument capable of comprehensively assessing treatment targets, disease activity grading, flare identification, and measure improvement hindered our ability to intervene effectively. Join us in this presentation as we explore the performance of instruments in detecting lupus flares. Discover actionable predictors that can be incorporated into our clinical practice, allowing us to proactively prevent flares and optimize patient management. Learn about the remarkable advancements facilitated by the SLE Disease Activity Score. This new tool, with its high sensitivity to change, easily integrates into our clinical practice. With the SLE DAS, we can reliably assess disease activity at each visit, enabling for promptly identifying flares and tailor treatments accordingly. Together, let's pave the way for improved outcomes and optimized quality of life for our patients. Thank you, and looking forward for meeting you at the Congress.